So welcome to this next episode in our series called Wired for Wellbeing. Today I'm here with my lovely business partner and friend Sue Coleman, as always. We're our co-hosts of this Wired for Wellbeing podcast, which is sponsored by the Viva event. The Viva event, we are co-founders of that, co-founders, co-creators, and we're delighted to be able to initially, I've realised, in conversation with with the 18 speakers that we have this year. The event takes place 1st to the 3rd of November in 2025, and we're starting this podcast by having conversations with them. And I'm going to hand over to Sue to introduce our next guest.
Thanks, SHEELA. So this afternoon we welcome Rani Bora, who we both know pretty well. And Rani is a psychiatrist. She's been with a fellow of the Royal College of Psychiatrists and has been a coach since 2007. So she's kind of wears two hats, but I think we'll find that those two hats are not different in many ways. I'm particularly delighted because through my journey with family, we've experienced quite close time with psychiatry practices, mental health services. And I always longed for somebody like Rani to come along, because I think deep down I just fought those systems, because I thought there's got to be something different. There's got to be something more hopeful. And there's got to be something that's not only just hopeful, but has real foundations that can help people. Like myself, I was frightened, I was struggling, I was trying to look after somebody, and I needed help too. And so I welcome you, Rani, with open arms, because I think what you have to share will be very, very impactful and helpful to all of our listeners. So thank you.
Oh, I'm delighted to be here. I love what you guys do, and I think this is incredible, and it's a gift to the world. Viva is a gift to the world. You guys are bringing something very precious, not just to Spain, but worldwide. You're reaching out to people, and this podcast really delights me that you are coming up with this podcast to share this beautiful message of hope and beyond. So thank you for having me as your guest.
Beautiful. Thank you. Well, as Sue said, we're very lucky to have you. And so following on from what Sue was speaking about in terms of mental health, we know that you've coined a phrase, mental wealth. So I think a good place to start would to be really hear about what it is that you've seen differently all those years ago that you came across the three principles that we base this the Viva events all around, the three principles, understanding. And perhaps you could unpack that a little bit through this conversation. So what did you see differently from your traditional psychiatric training? Is that what you call it? Psychiatry training to what you've seen through the understanding of the three principles?
Thank you. So let me share a bit of my personal story and what led me to this path. So I have been insecure as a child. I became insecure as an adult, and no major trauma or anything. But I had this limiting belief, like most of us had. I had this limiting belief that I was somehow not good enough, and so, but I didn't know what to do about it, especially not in India when I was in India. So when me and my husband Suraj got married back in 2001, and we came to the UK, it's really fascinating because many of my limiting beliefs came to the surface, and I found myself in a very different country, different cultures, seeing white people mainly in Turkey area, in Devon, and I was like, ah. Although I was in a better place than most people because I was a doctor, right? I was already a doctor, had trained there, and I started my psychiatry training back in India, but I didn't complete it because I thought I can start it here in terms of training to be a psychiatrist. So it was very easy for me to hide behind the facade of being a doctor and start my training in 2002. It's fascinating because at the same time as I started my training in psychiatry, I also felt there was this thing about let me work on myself And how I did that was self-help. Like we went to lots and lots of different self-development seminars, including Tony Robbins, Unleash the Power Within, Walking on Fire, and said, cool, moss, cool, moss. That's how it all got started. And then at some point, as I was being a junior doctor, and I thought, hey, maybe I can train as a coach. And that's when I started to train as a coach back in 2007, formal training. But it seemed like I was like dipping my toes in two different worlds. One was the self-help where everything's amazing, like, okay, everyone is whole and your confidence and high version of yourself. And then psychiatry, like, yes, but. Or those are for like all these people who are already well, not in psychiatry. Yeah. And I was working in the NHS, and as a junior doctor in psychiatry, I was guided. I had, I was learning and I was soaking up all the information. And it really seemed like that to me that, oh, that's okay, but that's in where people are already normal and they wanted a bit of a tweak, not for people who are damaged or broken, because that was what I bought into. I bought into a paradigm that where the main dominance was that something's wrong, we need to fix it. And so I didn't question it. Why would I question it? Because we had got lots of evidence base. And as a junior doctor, I also had training in therapy, right? And not like full training, but it's like enough to then do case studies with our supervisors. So I trained in cognitive behavior therapy, or CBT, and cognitive analytic therapy, or what we call CAT, or psychodynamic therapy, family therapy. And like, yeah, we felt that, oh, when it comes to biopsychosocial, we were ticking all the box. We knew what the biopsychosocial factors were, that led to mental illness. So we said, okay, there's genetics in terms of biological factors. There are like psychological. Some people have like trauma maybe, and like they have some limiting beliefs, and like social factors. Maybe they are the poor, or they are not well to do, and they're really struggling with dynamics and environment and so on. So if these are the causes that we were trained in, what are the solutions? So biological, yeah, give medication, drugs, psychotropic medications, starting from antidepressants to whatever, depending on the diagnosis. And then when it comes to psychological, okay, let's sort out the psychological. Okay, let's refer to the therapist. Okay, or like I said, as a junior doctor, I had like my own small number of cases I needed to do to complete my training. And social, or let's involve the social services. Let's involve the social worker, and let's work with the other services. So it seemed to me like we were doing a pretty good job, and we would have. As junior doctors, we also needed to know the evidence base in psychiatry. So we would go to journal clubs, for example. So in the journal clubs, basically we are looking at the papers, the randomized controlled trials, the all the like studies, that quantitative studies, qualitative studies, and more than the randomized controlled trials, like pulling them all together and saying, is this working? What's the evidence base? So we would like, I was proud to be like, okay, I have got everything I needed in order to really help people and serve people who have got mental health problems or mental illness. And yet, like, no matter what you read in textbook, this is depression, this is severe depression, this is mild, moderate, severe depression, or this is the ICD-10 criteria. Now I know it's ICD-11, but back then we started with ICD-10, or International Classification of Diseases, as we call it. So we say, this person fits mild, moderate, severe, this is schizophrenia, this is affective disorder. And although you read all those in books and all those in papers, and you go to conferences and say, yeah, I got that, it was fascinating where someone presented to me. And I can only speak for myself, but it's like, yes, and they have got this, the comorbidity we call it. So not they have depression and they have got this going on, or they have got psychosis, acute, stress-induced psychosis, but they have got this going on. So it's felt like our patients were not fitting into need boxes. If they were need boxes, maybe they would go to primary care, but we were secondary care. In NHS is part of secondary care, so we got more complex patients. So one thing I noticed as a trend is most of the patients that came to us did not seem to get better. And when, what can I say? Like, at least I saw that the longer they were in secondary care, and they were taking medication, the diagnosis changed over time. So maybe they started with stress-induced, okay, maybe stress-related anxiety. Then later on, it might be actually they have got mood disorder. Then it comes schizoaffective disorder, and you think the same person, and they're like they have got the longer they have been in the care of services, it's like that most people, not everyone, seems to have different diagnoses. And different people, they see different psychiatrists, and then suddenly they're given another opinion, another diagnosis. So all this was going on at the same time as I was also training to be a coach, and I was going to all these different conferences and weekends, and I just felt so much at peace. And the last thing I saw in the NHS was that my patients were not at peace, right? And I didn't see that my colleagues were at peace. Like, at least like everyone was stressed, or most of them were stressed. And so it seemed like, yeah, I can do all those, but I have to park, like, like Sue was saying, they're different universe. I can't bring them together. So I continued this journey for some time until I came across the what we call the three principles understanding. And initially I had a very intellectual, I had lots of like intellectualization about it, and I was very skeptical. Oh God, I think it's easier for people to get something, to shift something, if you are not well trained in mental health kind. But for me, it was like, oh, it's all bollocks. He's talking about CBT and mindfulness. Like, I had that kind of listening to Sydney Banks, and I'm so sorry, but at the time I thought he put me off. I thought he put me off with his Scottish accent and the way he spoke. And yet I knew that there was something there. And Suraj said, my husband said, why don't you listen to someone else that you might resonate with? And I went to Michael Neal and said, okay, this guy is a bit better. And then I had my own one-to-one session with a coach back then called Ann Ross. And something I would say something profound, something spiritual happened in the session I had with her. It was over 2 hours. And without that session, I think I would just have intellectualized it and thought, oh, this is CBT and mindfulness. Because in that session, it was beyond my thinking. And it was not like a, woo, I'm amazing, this is amazing kind of experience. It was like I was hit hard by something, like something dark crossing my consciousness or crossing my mind. I don't know how to articulate it, and it's all darkness. And then the words that came to me when I was sobbing hysterically was that all this time I thought I was a recovery oriented psychiatrist doing the best for my patients, but actually I was trying to fix my patients. And that just landed. And the I guess I got very emotionally intense, because I think it was a kind of experience I had of some dark energy that I felt was in psychiatry that maybe I didn't know how to articulate, but I knew at some level. And that was the beginning of my journey. And it didn't happen overnight, but definitely what changed overnight was it was the same person sitting in front of me. Back then I was a rehabilitation psychiatrist, so people who came to me were like what we would call hardcore chronic psychosis or schizophrenia, chronic health problems, chronic uh, all kinds of problems, complex, with high risk. And no matter how they presented, there was something else that like shifted for me. And I realized that there was more to the stories. And at least with some patients, I could go beyond that. And I know that it also shifted for them. So that's my story. So people might think like, how do you do that, Rani? I don't think it's doing. It's more of in a way, chipping away happened as I started getting curious, as I started to wonder, how help my patients better. So I guess this is the best way to explain my journey into how I came across the principles of what I call mental wealth.
That's fascinating. Thank you. That's very thorough. What I'm hearing there, I think, is that you saw what you were doing as recovery, and for many years you thought that was that model was okay, it was good, but
And that was it. Yeah, we can't do anything else.
and that you externally were trying to fix something which we would say is internal to another person, and it all made sense in that paradigm. And then is it the case that what you shifted to, which actually doesn't require 10 textbooks, is seeing that within a person there is this health at their core, that whatever has gone on and whatever theories we apply to it, that person still has that innate health, that innate resilience, and the capacity to recover as they see it, as they gain insight, and you can help them to do that. So that feels like almost an opposite. Is that too extreme to say that, do you think?
I would say that for me, at least, it has been like a 360-degree turn. It has. And I can still see that I can do psychiatry from a very profound, deep level that I never thought was possible for not just me, for anyone. And I see where people get stuck in the stories. I really do. And there's a part of me still sometimes like trying to like fix it for them. And then when I allow myself to get quiet and be present, and I'm very happy to use tools, and rather than going to pharmaceutical tools, I have to say I go for more non-pharmacological tools, like the tapping, any body work that I might do, like anything to help them be in this moment a little bit, so that their mind can quiet down and they can hear something. And, and, and so what I'm seeing more and more, Sue, is that, yeah, I guess what I'm wanting to say here is the more I explore this for myself, I know I'm able more to serve my patients or my clients. That's all I can say, and it's not about a doing or like saying, oh, these are the three principles, like using their words and really pointing them to energy. It's all energy, yeah. And most people say that, oh, my energy is low, I'm feeling low in mood. What does it mean when people say I'm feeling low, I'm feeling depressed? It's just that their energy is very low and the vibration of the energy is low. And if they want to feel better, it's like is about that, then they will say, I'm starting to feel better. All it means is the energy is flowing in a way that's more harmonious to the wider energy. And it's not like high as in manic, because that's not harmonious to an energy, but it's a beautiful balance. And so that's one way I might be articulating with someone who really does not get it. I might just speak in the sense of energy and mood and up and down and state of consciousness, but maybe say something different which lands with them.
I was going to ask you would you have a specific story to share as an illustration for how how you've changed and what you see has changed, as to how that would be different in how you treat a patient, for example, or a client, how you be with a client? Do you have a specific story that comes to mind that would illustrate that?
Story about me, like how I deal with things, or story
No,
about...
with a patient
Okay.
or client.
So say, for example, if this person I'm thinking of, okay, he's been working with me for 18 months or maybe longer. If he had come to me pre my understanding of mental wealth, basically what's what's already within you. That's by paradigm, by the way. When I say mental wealth, basically the question is what's already within you. Let's uncover that. Whereas the traditional paradigm, which I would have treated with him from, would have been what's wrong with you. Let's fix that. Or the trauma-informed paradigm, which is like what happened to you. Let's explore that story. Let's explore that story. So if this guy who's been working with me for more than 18 months and had a huge like transformation and is continuing to work with me, if he had come to me prior to this, if he had spoken about, oh, these voices I hear, these intrusive thoughts, and he has a diagnosis of psychosis, and he at the same time he wants to reduce his medication, I would have said, oh, no, you can't reduce a medication. And if the voices, like, let me see, like, oh, these voices are affecting you still, and from time to time they get worse, why don't we increase your medication? So that would have been my approach. And in terms of like helping him, because you remember I used to be a recovery-oriented psychiatrist, I would say, okay, if the intrusive thoughts come, let's fix this, okay? And I would go through the CBT type, like, okay, what can you do? And all that is handy, but without the foundation of the principles, okay? So I would have relied on the medication, increasing the dose, topping up, giving more combination that he's already on, and also trying to change his mind and his behavior. What's been different now, given like I feel that every time, every single day I'm seeing deeper, and I have been sharing this understanding for many years now. My approach to him have been very gentle, no fixing straight away, and I had to be patient with him, because when he became quite unwell, that he sent me some very difficult messages. And of course I had to have the boundary, and I could have said before, Rani would have said, oh, no, that means I stop working with you. But I knew that this was not him, and he did apologize, and I wanted to give him a second chance, and we set the boundary. But it's fascinating, like as we have been exploring the three principles understanding, and he has been getting a sense again in his own way. This is why he's so gentle. um, it's clear that his parents used to give me feedback, like we are doing coaching, right? We are doing mental wealth coaching. His parents used to give feedback, and before, like I had to see him every week, and every 2 weeks or so there would be a kind of incident, something, and the parents would say, oh, what shall we do with him? And then over time it became fortnightly, and I was just doing like 45 minutes maybe, just to give him the space. But what's shifted is like he is so like, there's no incident for many months now. And before, the parents used to say, okay, can you teach him some techniques? And I knew I was not going to teach him techniques, but given his understanding, we could also look at creating some systems in place, using his creativity to what works. And he's a delight to work with. He uses metaphors, and there's a shift. And I know that we are not talking about a linear, okay, change in this guy. I have seen a quantum leap in him. He's already exploring things. He's seeing things very differently. None of this would have been possible if I had not seen, and I had not followed my intuition of how I can best serve my patients. So this is an example I can think of what I would have done before, and how I work with patients or clients now.
That's so super positive. Because really, when there's somebody who's suffering in the way you've described, there's a lot of people around them usually who are also suffering because of all the emotions. It's the thinking, isn't it? It's the fear, it's the anxiety, it's the what if, and it's looking forward in time, and it's maybe regretting things in the past. And what I heard you say right at the beginning was getting present. So you were emphasizing that when we're present, something else becomes available, or it goes from the invisible to the visible. And is that something you would say is a significant aspect of how you work with people, the listening and the presence?
Yeah, and I want to read out a line for you. Not written by me, but I can see how someone who has no clue about the three principles and maybe listening to our conversation for the first time may hear something for them. And actually, this writing, I just came from a meeting with this GP, who is a lovely colleague of mine, and he is very much into holistic ways of being, and he's into flower essence, by the way. And he wrote this, and then he shared this with me. And one line I'll read, I just connected with, and someone listening to us might connect. His line is, "We are both software being and hardware body. The body being the vehicle for the being." Okay, we are both software being and the hardware body, the body being the vehicle for the being. I know that in the body you can also put mind and body. Okay, you can say that the vehicle is hardware is a mind and body, the personal mind and the body. What I feel psychiatry does, or in a very like, I know that many people in like the world of mental health, they're really trying their best to help people, and they don't know what they don't know. Just like I had no clue about this. So I was looking at in a way, it's only a metaphor, don't stretch it too far. I was just looking at the personal mind and the personal body and the body, obviously, and was like, okay, eat healthy and do some steps and just try to calm your mind with mindfulness and let's do CBT. It's all great, except that we are not looking at the software being, because the body being the vehicle for the being. So all I'm saying is, yes, presence, yes, about like really tuning in and listening, and we can't separate the mind, body, and spirit. And what psychiatry is doing at the moment, and what health in general they will talk about, is, yeah, there is it's related, it's connected. Mind and body are connected, period. Okay, if mind is disturbed, we have physical problems, and if we have physical problems, it's going to affect the mind. But we are not thinking about being, we are not thinking about spirit or considering spiritual essence. And so when we consider this, and that, yes, we have to look after our body as well, we have to look after our mind, but we can't just go there and stay there. It's about beyond. So I think that's what I would say about the presence, and also honoring and saying, what does your common sense or what does your wisdom guide you to do in terms of nutrition, in terms of this, in terms of slowing down. So that's how I work.
Beautiful. I'm looking at the time. We've only got a few minutes left, and I'm going to ask you how people can get in touch with you in a second. But I'm just came to me to say, for final words, I think for me personally right now, I feel like I'd really love to leave people with a sense of hope. If they're feeling mentally unwell at the moment, do you have a few words of wisdom, I guess, to share, an invitation or some suggestion of where they can look, or what they could inquire about? Anything that comes to mind as your final words of wisdom?
Yeah, I mean, one story or one belief that I've heard many people um, articulate is that somehow I'm broken, I'm damaged, and because all of this happened to me, I might work hard, and I'm going to work hard, but there's only so much to what I can do, or how much of peace of mind I can achieve. And I'm saying that, what if there's a possibility that is not true? What if this is, in a way, this is happening within time, space, and matter? Of course, it's very important to validate it, but there's something that's limitless. There's something can never be broken, because I ask people like, okay, our physical body can get broken. We can have broken sleep. We can have like feel a broken heart and broken mind. Yes, in the world of form, we can have this feeling of being lost, of hopeless, of being broken. But what we are pointing to, you and Sue and I are pointing to, and many people are pointing to, is something which is not informed. You know, we are talking about the formless, and how can the formless essence of who we truly are can never be broken. So if you were to just reflect on that and know that yes, periodically we all get lost, periodically we do feel like we're broken or not good enough. But again, I'm inviting everyone to continue having this curiosity, exploring the conversations that you and Sue are putting out in the world. And I would say definitely check out Cindy Banks. The main one, if you were to read one book and you're feeling really hopeless at the moment and you're saying, I can't read too many books, and I can read one book, if you're saying that it's going to change my life or I'll see something different, I'll say after this conversation, hearing this conversation, I would invite you to the listener to read The Second Chance by Sydney Banks with the context in mind. Like, you are going to sit there and say, I'm going to be guided. I'm going to be guided, and I know that if I allow myself to be guided and just tune into the story and allow myself to be guided and listen with my best listening, not through my ears, but from my being, from my heart, at the end there will be a lesson for me, a gift for me that maybe I haven't seen before. And that's what I would invite people to do, and to awaken hope and know that, whoa, we are not just talking about things to do, we are talking about a shift of being, realizing who you truly are.
Thank you, Rani. Absolutely beautiful.
Love you
Thank you
guys.
for your
Thank you.
time. Thank you for your message. Thank you for your sharing. We're so looking forward to having you at Viva this year as one of our keynote speakers. And if people would like to get in touch with you, what's the best way for them to contact you?
Through our website, or I'm on social media. If you just maybe type Dr. Rani Bora, then there might be many Ranis around, but there's only one Rani Bora, and there's only one Dr. Rani Bora.
Perfect. Wonderful. As I say, thank you so much for being with us, and we look forward to speaking with everybody very, very soon. And just to say, thevivaevent.com for tickets. All right. Bye for now.
Thank you, Rani. That was super lovely.
Thank you.
Bye-bye.
Bye.